Hello, anatomy colleagues. Let's discuss the muscles of the thorax. So this should kind of fall in line after the discussion we had in terms of the bones of the thorax. We're going to talk about some smaller muscles that play a big role in terms of the intercostal space, and then we'll talk about the big muscle in terms of respiration, the diaphragm. One thing we are not going to discuss here, even though they are very prominent when you're looking at the thorax, are many of these axio-appendicular muscles. So these muscle bellies generally are going to be located on the thorax, but we're going to discuss them with the upper limb because their distal attachments are sometimes on the scapula or the humerus, so they'll play more of a role in terms of the actions that occur there. But I did want to mention them here because they certainly are prominent when looking at the thorax. So the pectoralis major is kind of one of the big ones. It does have its proximal attachments over here on the sternum and the ribs, but it's going to play a bigger role in terms of being able to move the upper limb. Okay, so let's talk about these intercostal muscles. And like I mentioned, and I think this close-up really shows it nicely, here's a rib, and then filling up this intercostal space will be these intercostal muscles. There are three different layers. The two more superficial layers, the external and the internal, are going to play a bigger role. There is a third layer, the innermost. And really kind of functioning together, these muscles are going to play a role in really just keeping up the integrity of the thoracic cage. So it's going to keep it stiff. It's going to keep it from collapsing during the actions that occur during respiration. But on the more individual level, the external intercostal muscles and internal intercostal muscles can play a role in terms of, specifically with the externals, it's going to be most active during inspiration. It will increase thoracic cage size, whereas the internal intercostals will be more active during expiration, so kind of breathing out, specifically when forcefully breathing out. So they can play a role there. What's cool, you can really see, so if you see like the muscle fiber direction for the external intercostals, you'll see that the internal intercostals are kind of going at these opposite angles. It looks like almost plywood in terms of how these are organized, the muscle fibers, and really plays an important role in terms of the integrity of the entire thoracic cage. Now let's discuss the big one, which is the diaphragm. And we've probably all heard of the diaphragm below, diaphragmatic breathing, that type of thing. But a lot of times we don't think of it as much as a muscle or a skeletal muscle, and it most certainly is. It is a large muscle, but it is a thin muscle. And it is going to be right at the bottom of the thoracic cavity. So it separates the thoracic from the abdominal cavities. And it's the big one, as I mentioned. This is the chief muscle of inspiration. When it contracts, it kind of flattens the diaphragm, which will allow for the thoracic cage size to increase. And so that allows the thoracic cavity to expand to allow for air to kind of move in. And then when it relaxes, it will kind of, you can see it kind of reduces the size of the thoracic cavity. So forcing air out in terms of expiration. It is innervated by the phrenic nerve, which is going to be a peripheral nerve that is going to involve fibers from cervical spinal nerves C3, 4, and 5. And there's a nifty little rhyme that goes with this. C3, 4, and 5 keep the diaphragm alive. So if you ever have damage to any of these specific spinal nerves, this could have implications in terms of the phrenic nerve, and obviously some fairly huge implications in terms of inspiration. Now, as this muscle is going to be found between the thoracic cavity and the abdominal cavity, you've got some fairly large and extremely important structures that are going to traverse this muscle. And I like this illustration a lot. It's as if you were standing in the thoracic cavity looking down at the diaphragm. So this is kind of a superior view. And you can see these openings here. You have a caval opening, which is where the inferior vena cava is going to traverse. So all that deoxygenated blood from the lower limb, the abdominal region, is going to kind of traverse through the inferior vena cava in order to get up to the right atrium of the heart. So very important there. You will have an esophageal hiatus. So this is where the esophagus is going to traverse in order to get into the abdominal cavity, and will transition to the stomach. Also, you're going to have the vagus nerves that are traveling in really close approximation to the esophagus, which is hugely important in terms of the parasympathetics associated with the gastrointestinal tract. And then last but not least, you have the aortic hiatus, and this is where the descending aorta will descend, as its name would suggest, in order to supply blood to portions inferior to the diaphragm. Additionally, the thoracic duct is going to traverse here, so very important in terms of lymphatics. So much more to come on this structure when you get to the lymphatics lecture a little bit later on. But really, this is an important area in terms of traversing between the thoracic cavity and the abdominal cavity. All right, excellent. So we talked about the primary muscle in terms of inspiration is going to be the diaphragm. That's the big one. But which intercostal muscle is most active during inspiration? So it plays kind of a supplementary role to the diaphragm. Is it external, innermost, or internal? All right, and when you're ready to talk about it, I hope you landed on A, external being the correct answer. We didn't talk so much about the innermost actions. It really plays kind of a supportive role, similar to the internal intercostals as well. The internal intercostals will play a role in terms of forced expiration. So not that answer. It's the external, or those most superficial intercostal muscles, that are going to be most active during inspiration, but is not the major muscle of inspiration. That, of course, is our good friend, the diaphragm. All right, thank you so much for your time and attention here. I will see you in the next video where we start talking about the abdomen. Thanks.